Hello, everyone. Hope that you are having a great start to your day. My name is Cole. I'm the co founder and head of growth here at Move Health. And today we're going to talk about Medicare. And so we have a couple people that are still trickling into the conversation, but looking forward to connecting with you all and talking about what turning 65 might look like and more. And so excited about today's session. If you are here for the online bowling tournament, that actually happens after this. So if you're a little bit early for the bowling tournament, but maybe I'm kidding. There's no bowling tournament. I don't host online bowling tournaments, but it's all good. But hey, we're gonna kick into Medicare here. We've got a great group. That is still assembling. Lots of folks in there. There's a chat functionality. Josie from our team, our director of marketing and community, has asked a question in there. I also like to ask the question of, tell us where you're tuning in from. And so you can use that chat functionality. And I will even type in there as I speak. I'll say that I live in Evansville, Indiana. I'd love to know where you all are at. You don't have to give me your specific location, but would love to understand. But without further ado, I'm going to pull up my screen here and we're going to talk about turning 65 and what you need to know about Medicare. There's a Charlotte, North Carolina out there. That's great. It's about as hot as it is in Evansville right now. And so good to hear from you there in the chat. Wisconsin, Tom and Deanne, that's awesome. Washington State turning 65 in less than a month. And it's a great time to connect with us. There's a Wilmington, North Carolina, a Colorado, a California. Josie, I know you're in Dallas. Good to see you all. Thanks for indulging me and letting me know where you all are at. It also will help to provide some context throughout the conversation today, believe it or not. So we're going to dive in, turning 65 and what you need to know about Medicare. A couple housekeeping items as well. Yes, we are recording this session. Yes, you will get the recording. It comes to you automatically about 24 hours after the meeting or the session today ends. So you'll get the recording. You can share it with friends, family, things along those lines as you'd like to, and we'll dive in. So there we go, Grass Valley, California, another one out there. Good to see you as well. All right, so a little bit about Move Health because you need to know who we are and who I am, and so I'll talk a little bit about who I am in a moment, but who we are so you're getting good advice and feedback and all of those things. So Move Health, we work with financial advisors and their clients, to help with health insurance and Medicare planning. And so a lot of times what this looks like is we're helping someone who's a client of a financial advisor who might be coming up on age 65, or maybe they're turning 65 and retiring, but their spouse is 62. And we've got to figure out that bridge to Medicare. Or maybe they're just like my in-laws. The reason I wanted to start this business, they retired at 59 and they needed help from their, financial advisor, or requested it on health insurance and Medicare planning. And the advisor that they were working with at that point didn't really provide them that guidance and feedback. And so it showed me that Move Health was something we needed to build, which is to help clients of financial advisors to work through these, life transitions or life moves, right? So we can help with pre-65 health insurance, the marketplace, covered California, get covered, Illinois, what have you, all of those things. We can also help with Medicare, and that's what we're going to be talking about today. And again, we're purpose built for advisors and their clients. And so you'll get some notes on what to do next and all of those things after this conversation. One more housekeeping item. Again, I love that chat functionality. So as we get into the content today, please, please, please use that chat functionality and ask your questions there. I would love to get those answered for you to the best of my ability. I like to think that I am an expert in the space. And so, use the time, ask me anything. I guess it doesn't even have to be Medicare related. My favorite ice cream is mint chocolate chip. We'll just get that one out of the way because I know someone was going to ask it. They always do. All jokes aside, here's a little bit about me. Before I'm the co-founder and the head of growth at Move Health, most important, my two favorite jobs are husband and dad. And so that's my incredible wife, Megan, our two little boys, Porter and Conrad. I'm a musician, so I love playing music. I've done that professionally for a number of years. We live in an old 1917 Tudor revival house that we've done a ton of renovation work on, and thankfully that is not what our kitchen looks like right now, but it did at one point about this time last year. And this is our family on the beach. We're also welcoming our third kiddo here in just about a month, and so we're thrilled about that as well. So that's a little bit about me. diving into Medicare specifically. So, everything that I talk about today is going to be framed around the transition to Medicare and specifically around turning 65 and someone who's turning 65 and transitioning to Medicare. I'll touch on towards the end of the conversation what that might look like. If you are someone who's working past 65, we'll talk about that. So, we'll cover off on those details, but we're going to frame it with the reference point of turning 65. So before we can dive into any of those things, we've got to get a high-level overview of Medicare as a whole, and we've got to figure out what this fork in the road means, right? So you can see there's a fork in the road, and we're going to figure out what direction might make the most sense, or you're at the very least going to understand the pros and cons of taking a left or taking a right, and right does not mean right, and left does not mean wrong, and vice versa. And so looking forward to working through those today. So you've got this fork in the road. Before we can really dive into that fork in the road and understand what direction we need to go, we need to understand Medicare Parts A and B, Alpha and Bravo. And so as we dive into Medicare Parts A and B, it's important to note that those are referenced commonly as original Medicare. So whenever you hear me say original or traditional Medicare, I'm referencing Medicare Parts A and B alone, on their own. So there are a couple of things that are important to know about Medicare Part A and Part B. We're going to start on Part A, Part Alpha. Part A is the hospital portion. This is inpatient hospital, skilled nursing, home health, and hospice. The important thing, and one of the things that one of my team members references here at Move Health, is they say that Part A is the bed that you're laying in, the Jello that you're eating, and the nurse that brought it to you. Right? That's the hospital portion. Typically, Part A, it generally doesn't have a monthly premium. You typically get this for free, and you can pick this up at age 65, and it's not going to cost you anything so long as you or a spouse of yours has worked 40 quarters. And it's because Medicare Part A and Part B are closely tied to the Social Security Administration. And so Part A requires you to have those 40 quarters to get Medicare Part A premium free. It's got a deductible of $1,736 for 2026, and that's per benefit period. So I always like to say, hey, we probably really don't need to worry about this number here, and we'll talk about why a little bit later on. But per deductible, per benefit period, what does that per benefit period mean? Well, it means that this is a rolling deductible that operates on a rolling 60-day window. So theoretically, you could hit this deductible or pay this deductible in a very, very bad, no good year. You could pay that deductible 5 times technically, because you could have it on, go in on January the 1st and hit this deductible. And then 61 days later, however many days that is into, I think maybe early March, you could hit it again. And so it rolls every 60 days. We're going to talk about why that doesn't necessarily matter, but that is an important component of it. If you had original Medicare only, you'd have to deal with this deductible. It is 100% for approved coverage for approved home health, hospice, and days 1 through 20 in a skilled nursing facility. It is important to note that Medicare, in any capacity, is not a suitable long-term care plan, right? Medicare Parts A and B are really supposed to be medical, and they will help with, a skilled nursing facility, but only for a period of time. And so Medicare is not your long-term care strategy or your long-term care plan. Those are important to designate there. It will cover parts of it, but not forever and in limited capacity. So that's Part A. Part Alpha is in hospital. Part B is in medical. This is everything else effectively medically. This is your doctors, the surgeon that you might see to have your surgery done, outpatient labs, testing that you have done. If you've got a medication that is administered in a doctor's office, like an infusion or an injection, things along those lines, those are all going to go towards Part B. Now, Part B, as in Bravo, this is the part that you pay for. You're going to pay a standard Part B premium. So standard Part B is $202.90 a month, so $203 a month in 2026. There's also this thing called IRMA, which we're going to talk about here in just a little bit, but we're not going to touch on that right now. So standard Part B, you pay for it. That's the thing you need about Medicare Part B is you pay for it. It has a $283 deductible. that, confusing enough, is not per benefit period, is an annual deductible. And after the deductible is met, Medicare is generally going to pay 80%. And you are going to pay 20% with no annual cap. And someone goes, wow, Medicare is going to pay 80%. I pay 20%. That sounds pretty good. The reference that I always give is I talk about a knee surgery that I had somewhat recently. And that knee surgery billed my insurance at $107,000, right? So if I were on Medicare Parts A and B or original Medicare only, I would be on the hook for how much? 20 grand or thereabouts, just a little bit more actually, inclusive of 20% of all of my, physical therapy afterwards and all of those things. And the reason being is Medicare Parts A and B, original Medicare, aren't meant to cover everything. They're going to pick up the vast majority of it. And so Part A and B are only going to cover 80% of your costs. This is important to note. And there's no annual cap, right? And so that means that if it's $100,000 knee surgery, you're going to pay $20,000. If it's a $1 million treatment of, cancer treatment with infusions and surgeries and all those things over a year, you're on the hook for 200 grand. And guess what? If you only have original Medicare A and B, you can't apply and say, hey, this should be covered, this shouldn't, etc. It's important to note that parts A and B only cover 80% of your costs. If there's any questions, feel free again to use that chat functionality. One thing that I talked about when I was referencing Part B, that's the part that you pay for. And remember, $203 is the standard Part B premium in 2026. And that updates annually and usually goes up with the cost of living. And so next year, we expect that to probably be maybe $220 in 2027 per month is the standard Part B. But there's also this thing called IRMA. And what I say often is this isn't a hurricane. It's not your aunt. It's not your grandma. IRMA is the income-related monthly adjusted amount. And I oftentimes call this the you did well for yourself tax. And what that means is that this is an increase that applies to Medicare Part B and Part D premiums. We haven't gotten to Part D yet, but we will. And it's based upon your income from 2 years ago. And the reason that they say it's based upon your income from 2 years ago is sometimes, as an example, there are folks that have still not filed their 2025 taxes yet because maybe they're on an extension until October 15th, etc. And so most people have filed their 2024 taxes though. And so that's how they look at that. They'll say, hey, based upon your income from 2 years ago, you may pay more for your Medicare. So as an example, it's a relation to your tax filing status, which is each of these blue columns here, and your income. So as an example, if I was a married filing jointly couple, and this is household income, not just individual income, and we made less than $218,000 in income in 2024, we'd pay the standard Part B premium, which is right here. And we'd have nothing that's additional to our Part D. If we made $500,000 in 2024 as a married filing jointly couple, we would pay $649.20 for our Part B premium. And so it's your $202.90 plus IRMA. And so you're going to pay $649.20. IRMA is per person, right? Your Part B premium is not for the family. This is an individual rate. And so, if you had a couple that were both transitioning to Medicare and you made $500,000 2 years ago, you would be paying $649.20 each. Plus, there's a premium that, a surcharge that goes onto your Part D coverage as well of $83.30, and that's per person on Medicare. And you can see the differences for annual income for an individual or if you are married filing separately. So married filing jointly is where we see a lot of folks, and also individual. So all of that to be said, those tiers determine what you pay for your Medicare Part B and part of your Part D as well. IRMA, it doesn't always stick around forever, but there are also instances where you can appeal IRMA, where you could say, my 2026 income when I retire at 65 is not going to be as big as it was when I was working at 63. So in that case, you have to wait for it to be assessed, but you can appeal IRMA for a work stoppage, and a lot of times that can happen. If you are someone who is earning, going to continue to earn lots of dollars, in retirement or into Medicare, it doesn't really make sense to appeal IRMA. But let's say that income from 2 years ago was $750,000 or more, and your income is going to go down to, say, $250,000 a year. You can appeal it, and you might not remove all of it, but you might get to a point where you're paying much less per month. So it's always worth reviewing there. And there's a question in the chat here that says, is Medicare B optional if I still work? I've signed up for it, but was surprised by the bill. Didn't realize there was a charge. If it's optional under my circumstances, can I withdraw it? I will touch on that here, Anne, in just a little bit. Yes, you can. There's a process in which to do that. But we'll talk about that in kind of that working past 65 component. It's a really, really good question. And I see that you sent it just to the hosts and panelists, but Anne asked a question if Medicare was optional if you are still working. We'll talk about working past 65 here in a moment. Tim says, can people appeal IRMA when it was triggered by an extraordinary cap gains from a prior year? There are 8 ways that you can appeal IRMA, Tim. And what I can do is I can click this link and open it up and show you. This is the actual form that you fill out, SSA 44. And you can see the tiers here that we talked about. You can also see the differences, the different life-changing events here. So I'm zooming in on it. Step 1, life-changing events. Have any of these happened? So marriage, a divorce, a death of a spouse, a work stoppage, aka retirement, a reduction in hours, loss of an income producing property, pension income, or employer settlement payment. So a great question, Tim, but typically you can't appeal IRMA based upon an extraordinary capital gains event. And so it's a great question, but typically you cannot do that. So feel free to keep firing through questions. I love answering them as we go through, but that's IRMA. Now we get back to kind of that fork in the road. How do we choose a coverage option? Because if we go back here and we look at Medicare Parts A and B, yeah, we pay $203 a month for Part B medical. We pay nothing for Part A hospital, but that's only going to cover 80% of our costs. And that leaves a what? A gap, a 20% gap that we have to figure out how to fit. And that's what creates the fork in the road. So how do we choose a coverage option that's going to fill the gap, if you will? Now, the way that we do that is through either a Medicare supplement or a Medicare Advantage plan. Neither are right or wrong. I've got my preferences, but neither are right or wrong, and we'll talk about each of the pros and cons of each. A supplement, we'll do a double click here and kind of zoom in on each of these options. It's going to have a monthly premium that is in addition to your Medicare Part B and Part D premiums. So it's got a monthly premium. As an example, a 65-year-old male, I'm in Indiana, right, as I mentioned, might spend $120 to $140 a month on a Medicare supplement in addition to their Part B premium plus their drug plan. And so it does have a premium, but usually no copays. Supplements, they are going to be the most flexible in terms of where you can go and doctors you can see. There's no referrals necessary to see a specialist. And the reason that it's most flexible is because Medicare A and B, or original Medicare, continues to be, and I'm going to use an insurance term here, continues to be the primary payer. And primary payer means that Medicare A and B pays first. And so long as Medicare Parts A and B cover it, or the doctor that you go to takes Medicare, which is 98% plus across the country, your Medicare supplement is guaranteed to pick up that gap, right? We'll talk about the capacity in which it does that. And so it's covered anywhere that Medicare is accepted. And so if I'm in Indiana and say I want to go to, let's say I want to go to Cancer Centers of America in Arizona, I can go on a Medicare supplement. Or if I want to go to Mayo Clinic in Jacksonville, I can go. Or if I want to go to Norton Hospital in Louisville, I can do that. Or if I want to go to Wake Forest or Duke, I can do that with a Medicare supplement and original Medicare, because original Medicare is the primary payer. Moving over to Medicare Advantage, it typically doesn't have a monthly premium, or it has a low monthly premium. So it might be $0, it might be less than $50 a month, but you might have copays that are paid at the time of service. You're more than likely going to be restricted to a specific network. So you're not going to have the open anywhere Medicare's accepted network, and you're only going to have emergency services or coverage available outside of your network. So this might be an HMO or an EPO. There are some places that have Medicare Advantage plans that are PPOs, but those are a little more, those are few and far between. And some might include some perks and benefits like dental and vision or over-the-counter things along those lines. To give you a frame of reference, You almost never, I've never seen it in my entire, decade or better in health insurance and Medicare. I've never seen a TV commercial for a Medicare supplement. Never seen one, right? Whereas Medicare Advantage, I see quarterbacks and baseball players and TV stars and all of those things talking about Medicare Advantage. What I can tell you is in most cases, the football players and the baseball players and all of those things that are now 65 or better, they're not on Medicare Advantage plans. They're typically on a supplement. And so those are paid spokespersons. Good question in the chat here. TRICARE for Life will be my supplement, I believe. Does that sound right? Molly, yes, if you have TRICARE for Life, that is a good example. Typically we say don't touch that. Pick up Medicare Part A and B, but TRICARE for Life is going to cover you. If you want to dive deeper on that, we'll tell you how to get in touch with the team on that to answer that question in a little more detail. But yes. So Medicare supplements, Medicare Advantage. Medicare supplement, most flexible, but is going to have a monthly premium that's associated with it. Medicare Advantage, we'll talk about why it's not quite as flexible, but it has low or no monthly premiums. Let's dive in and go into Medicare supplements specifically. So we're going to talk about Medicare supplements or Medigap. These were started in the 60s and the 70s, but they were largely unregulated. So in the 90s, they were standardized across the board and they were provided plan names and all of these things. And so with Medicare supplements, there are plans and there are plans that run A through N. So not to be confused with Medicare's parts, Medicare supplements have plans. And as I mentioned, how a traditional Medicare supplement works, Medicare A and B are the primary payer. You then choose a Medicare supplement, a Medigap plan, to be secondary for that. When you go to the doctor, and this is where the rubber meets the road, when you go to the doctor, you're going to use your red, white, and blue Medicare card as well as your Medigap card. So as an example, you could say, I have Looney Tunes Insurance Company Medigap. And they could say, we don't take Looney Tunes Insurance Company. You say, it's a Medigap plan. Do you take Medicare? And they would say, yes. And you go, okay, great. Then you take my Looney Tunes Insurance Company. So if the doctor accepts Medicare, they are guaranteed to accept the Medicare supplement because the Medicare supplement is the secondary payer. So Medicare pays first, and then it's forwarded along to the Medicare supplement to pick up the rest according to the plan you are on. The two most common Medicare supplements that are enrolled in the United States right now are Plan F as in Frank and G as in girl. Plan F you can only get if you were eligible for Medicare before 1/1/2020. So if that's not you, so if you weren't 65, before 1/1/2020, you're likely going to go to a Plan G as the most, comprehensive option. What does the Plan G cover? Well, we're going to talk about this. And you notice here, this is a foreshadowing here. I'm not referencing a carrier at all. I'm saying, here's a Plan G. Doesn't matter the insurance carrier. The Plan G is going to cover the exact same things. Why? Because they were standardized in 1992, right? So Part B, deductible only. I don't know if there's anybody in the chat that can go back in the notes and remember in their brain what the Part B deductible was. If they want to put that in the chat, I'll award you some points, tell you how to redeem them at the end. But put it in the chat there if you remember what the Part B deductible is. Oh man, Tim is fast. He sent it to the host and the panelists. He said 283. It was quick. Way to go, Tim. Yes, you are exactly right. $283 is that. And for that, 283 points are awarded to your account. It is a little bit of a whose line is it anyway scenario. The points might not add up to anything, but pride at the end. But the Part B deductible. So the way that you can think about this is if I have a Medicare supplement Plan G, and I go and have my $107,000 knee surgery, and let's say that I had it on January the 1st. I was ringing in the new year with knee surgery, and I had original Medicare and a Medicare supplement Plan G. I would pay the Part B deductible only. So you can think about it this way. A Plan G Medicare supplement is a health insurance plan that you might spend $140 or $50 on a month plus your Part B premium. And if I have that $107,000 knee surgery, all I'm going to pay for that is $283. And then guess what? I'm done for the year. So Medicare Supplement Plan G really reduces your out-of-pocket exposure. With Plan F, it actually covered both the Part A and B deductible. So you didn't have any out of pocket. You go have your $107,000 knee surgery, and as long as you're paying your premium, it's all covered. Also, that Plan G, the $107,000 surgery, I pay my $283. I'm done. And then that includes all of my physical therapy afterwards, things, follow-ups with the surgeon, et cetera, et cetera. So it really reduces your out-of-pocket exposure. Now, you're going to see a chart here. We love charts. We love graphs. We love all those things. What are all of these? So up here on this top row, it's the Medicare supplemental plan name, right? So as I mentioned, A through N. I don't know why they got to skip E or why they skipped others, why there's not a Plan J. But they did skip some letters. Plan H would be neat, maybe. I don't know. But what you can see here is the green checks represent what they cover and what they don't. So as I mentioned, a Medicare Plan G, look at all these green checks. There's one X. What is it? It's the Medicare Part B deductible, which is $283. And so you note that. Where you can see Plan F, holy moly, it's all green, right? I will tell you from a point of reference, Plan G is definitely the most widely enrolled. I know there was one person out there that is that's in Wisconsin, and so I want to speak to them. Wisconsin has a little bit of a different name for their Medicare supplements, and so theirs would be the Medicare Basic Plan with riders is the Plan G equivalent there. Medicare Supplement Plan 1A in Massachusetts, if there's anybody out there from Massachusetts on the call today, is the Plan G equivalent. So, but for most places in the country, Plan G is going to be the most comprehensive you can get. Plan G and Plan N are the most prevalent, that are enrolled. You can't get a Plan F or a Plan C any longer unless you were eligible before 2020. But Plan N and Plan G are the ones that are used most often. I've never seen a Plan L enrolled ever, and I've seen lots of those, lots of people enrolled into Medicare. You can also come down here. We go, okay, let's look at the Plan G. Everything looks good. Check, check. We talked about that Part B deductible of $283. We also looked at Part B excess charges. Those are covered by Plan G. That's a lot of times why people opt for that over a Plan N, because there's when a doctor may charge more than the Medicare allotted amount, your Plan G supplement picks that up, whereas Plan N doesn't. The other thing that you'll note here, foreign travel emergency. Medicare is awesome. It's great. If you're on a Plan G supplement, you've got no network and you can go see any doctor that accepts Medicare and your out-of-pocket exposure on that plan is $283. It's awesome coverage. It is not awesome travel coverage. So if you're ever leaving the country, please buy travel insurance. It is cheap, 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 and it will save you a lot of heartache in the event that you actually need to use it. So don't use Medicare as your foreign travel plan or coverage strategy. A couple of things that are important to note, right? Down here, this second portion, this blue box off to the right, all Medicare supplements are substantially equivalent, that's an insurance term, based on the plan letter chosen. So as an example, a Plan G with Aetna or Cigna are going to offer identical coverage. There's no difference in what they will cover because a Plan G is a Plan G is a Plan G. So when you're looking at a Medicare supplement, you're looking for a couple of things. How do I shop a Medicare supplement if they all do the same things? Why are there different premiums? I thought they were standardized. A lot of times what you are paying for is historic rate increases, the things you want to look at. Historic rate increases. How much does the Medicare supplement premium go up? Does it really advertise a low rate for someone who's turning 65 and then see a double-digit percentage increase going into 66? There are places that'll say, we're going to be a loss leader in year one to lock them in for life. Because typically when you pick up a Medicare supplement, you pick it up for life. So we always want to look at historic rate increases. We also want to look at how easy are they to work with. Can you get a hold of them? What's the client experience like using a Medicare supplement? If everything's going according to plan, you really shouldn't be interfacing with your Medicare supplement carrier much at all. It should be a pretty hands-off relationship. They're going to pay in accordance with their agreement with Medicare and what they said they were going to do in accordance with this chart. But it's important to note that you always want to make certain you understand historic rate increases, ease of use with if you needed to call in about a claim or things along those lines. Those are the important things as you're looking at a Medicare supplement, because it doesn't matter. Again, like I mentioned, my Looney Tunes insurance company, Looney Tunes Insurance Company is going to cover, Plan G is going to cover the exact same thing as a big brand name, United Healthcare, Aetna, Cigna will do. Now, one note to make is that a larger carrier typically is going to have more covered individuals. And so those rate increases may be spread out across a larger pool of people, meaning that you're not going to see double digit rate increases, where is if you had someone who's only got 400 or 500 covered individuals on their Medicare supplemental plans, and they have a big year where they have to spend a lot, they're going to see larger rate increases going into future years. So you always want to make certain that you're doing your due diligence on that. We help with that at Move Health, help you to understand historic rate increases. The lowest cost Medicare supplement is not always the best one to start with, and we've got that information for you. So when you're comparing them, you can see this premium for this Globe Life and Accident Insurance Company is lower by $14 a month than this AARP by United Healthcare option. We look at that and we go, what's the difference? Truly, it's just the brand, because your out-of-pocket exposure is identical. The only difference is you're going to pay a little less per month here. There's different rating types. We'll always communicate that. There's attained age, which is what it sounds like. How old are you each year? That's what we'll do that on. And then there's community rated for their rating type. And that could be that based upon the location that you are in. They do it by zip code and FIPS code and all those things to rate the plans. At the end of the day, a community rated plan and an attained age rated plan are going to increase at about the same rate annually. And so all of that to be said, things that are important to know what they are. There's also, you can see here, a high deductible Plan G. We don't recommend those often because your annual financial risk is typically larger than what the premium savings is. And so Plan G is our favorite Medicare supplement because it's the most comprehensive. But there are high deductible Plan Gs, Plan Ns, things along those lines as well. We'll help you to compare and contrast each of those. Medicare Part C, Medicare Advantage. I don't love that they call it Medicare Part C because that makes it sound like it's a part of original Medicare. It's not. It was created in 2006, and Medicare itself was created in the 1960s. And so A and B started in the 1960s. Medicare Part C came along in 2006, and this is Medicare Advantage. What you need to know about Part C or Medicare Advantage plans. They're going to include, in most cases, they're definitely going to include your Part A and B. You still need to pay your Medicare Part B premium. It may include drug coverage. Many times it does. So sometimes there's MA only plans, so Medicare Advantage only. And then most of the time it's MAPD, Medicare Advantage prescription drug, that includes that. They usually have a low or no premium, and deductibles and copays are set by who? The insurance carrier. So I'm going to go down here to this important note. So a Medicare Advantage plan is covered through a private health insurance company that contracts with Medicare. So what this means and what this looks like in practice is, you remember that phrase I used, primary payer? Medicare, when you have a Medicare Advantage plan, is no longer the primary payer. So what this looks like in practice is that a Medicare Advantage plan is, the insurance carrier becomes the person who's footing the bill. And Medicare itself, contracts with them and says, we're going to pay you a set amount per member to take the financial burden. And so the federal government pays the carrier to take some of that financial burden, if you will, for healthcare costs. And because of that, you no longer administrate your own Medicare. The insurance company does for you. So when you go to the doctor, you then give them your Medicare Advantage card, not your Medicare Part B, your Medicare Red, White, and Blue card and the Advantage Plan card. You just give them the Advantage Plan card. Why? Because your Advantage Plan is the primary payer. They pay first. So an insurance carrier says, hey, we're going to charge you $0 in premium for the plan, but you're going to pay for it when you use it. And because we don't want to have to pay a whole bunch of dollars, and we can go negotiate rates with specific hospitals and things along those lines, they input specific healthcare cost savings measures. So they'll say, we're going to put a network in place. So you have to see the doctors that are going to charge us the least. You might need a referral. You might need to do step therapy. So step therapy meaning you need to do 30 sessions of physical therapy before we let you have that hip replacement, things along those lines. And so, important to note that. And so they might have networks. It's going to be a little less flexible because you can see referrals required. It's going to have a network that you need to be in. And so If you want to go to Cancer Centers of America in Arizona and you live in Indiana, you likely can't do that on an Advantage plan because they'll say, we have oncologists in Indiana where you're at. If you want to go to the Mayo Clinic, can't really do that on a Medicare Advantage plan. And so that's an important note when you're thinking about Medicare Advantage as an option. And because they are the primary payer, they try to save dollars there. I had someone ask a question: does the supplemental insurance pay for prescription medication? A Medicare supplement, that's a great question. So a Medicare supplement, a Medigap plan alongside original Medicare, is not going to cover your prescription drug costs. It requires a Part D plan, which we're going to talk about here in a moment. A Medicare Advantage plan is going to many times include Part D prescription drug coverage. And so it's a really great question. Thank you for asking it. We'll get to drug coverage here in just a moment. The last thing about Medicare supplements, you can't use them in conjunction with a Medicare Advantage plan, excuse me. Last thing on Medicare Advantage here, you can't use it in conjunction with a Medicare supplement. So I can't say, I'm going to cover myself the most and I'm going to pay for a Medicare supplement and I'm going to get a Medicare Advantage plan. You can't do that. You choose one road. If you remember that fork in the road. And so you got that there. Medicare Advantage, again, bundles everything together. So you can see $0 premium or a low premium. There's only one PPO in this example here. And here's your out-of-pocket maximum, which is higher than what it is on the Medicare supplement side of things. Like Plan G is $283. This is $2,500. Plus you got a network and things along those lines. So always important to be thoughtful around those notes. So Medicare Advantage, it bundles everything together. That's where networks come into play. We're always going to double check if we're going the Advantage plan route, or if somebody wants to review that. We will then take into account, are your doctors in network? Is your hospital in network? Things along those lines. Are my medications covered by the Advantage plan? And all of this is things that we have to check. Why? Because it's a private insurance carrier that's the primary payer. Good questions. Next up, how do, and so this is to the question that we had in the Q&A section. How does Part D drug coverage work, and where does it fall into plan? So you can see here's this fork in the road that we've been talking about, because original Medicare Parts A and B, which we have to have with both of these options, is only going to cover 80%. So how do we fill this 80%, or the 20%? Well, we can do it with a Medicare Advantage plan. Most of them are going to include Part D coverage within them. Or we can go traditional Medicare with a Medigap or Medicare supplement and a Part D drug plan. So we're going to dive into drug coverage land now. You have to have Part D drug coverage regardless of which direction you go, or you could potentially be penalized. So what do you need to know about Part D as you come up on 65? Part D plans, when you buy them as standalone, are provided by private insurance carriers. So this could be, the big ones are Humana or WellCare or HealthSpring, which used to be Cigna. Those are the big ones. United Healthcare has prescription drug plans. They're provided by private insurance carriers. Part C, Medicare Advantage, like I mentioned, will many times include Part D coverage as a part of it. Part D plans, prescription drug plans, will vary from plan to plan. And so this can, how do we select a Part D drug plan? We'll get into that a little bit further, but you pick it based upon the medications that you take. We'll talk about if you don't take any medications, good for you, one, but you pick it based upon the medications that you take in the pharmacy you go to and things along those lines. So Part D, the plan premium is going to be uniquely set to you, right? The plan premium is set, but the choice of the plan is going to come down to what medications do I take and what pharmacy do I like to go to. And really the equation that we are doing, and it's fairly black and white, is am I paying the least amount monthly for the premium and paying the least amount for my prescription drugs? Yes? Okay, great. That's the plan. So really we kind of rope it into typically one overall cost, premiums plus expected drug costs. And again, as I mentioned, you have to have Part D coverage to avoid penalties. What about Medicare Part D has changed recently? Well, there's a $2,100 cap for out-of-pocket costs for prescription drugs in 2026. So this didn't always used to be the case. This was new for 2025, and there was a cap for out-of-pocket costs. Now, the medication that you take to apply to this cap to it must be covered by the prescription drug plan that you choose. So the way that I think about this is I'll give you an example of a real client of ours. They were spending over $10,000 a year on prescription medications. Why? Because they were, hitting the catastrophic phase of their Part D plan way back in, up until 2025, and they had multiple name brand expensive medications. And what this meant for them is that we could then go to a plan in 2025 that covers all of their drugs and caps their out of pocket expenses at $2,100. So it must be covered by the plan. That's an important note. So the way to think about that, and how do you know if the plan is covered? Well, we help you with that. But beyond just that, it's got to be covered by the formulary. That's another insurance term. But the formulary for the plan, must include the drugs that you take. So an easy way to think about this as well is if you take a medication that sounds like it could also be a European sports car, you are likely going to hit the $2,100 cap, right? Have you ever seen anybody driving a Ferrari Eloquis? Well, no, you haven't, because Eloquis is a blood pressure drug. What about a Lamborghini Jardiance? No, but that's a diabetes drug, right? So if it sounds like it could be a European sports car, expect to hit this out-of-pocket maximum or out-of-pocket costs. Eloquis now has some copays. It's been around for a little while, things like that. But that's just a funny way to think about it. If it sounds like a computer or an app on your phone or a European sports car, it's likely to be an expensive medication. You could plan for that out-of-pocket cost. If it sounds like a Ford Taurus, like, hey, I drive a Toyota Lisinopril, okay, great. It's probably going to be pretty inexpensive. So you can remember that when you're talking to doctors and they say, hey, we want to try this new medication. Okay, great. Just understand that we need to make certain there's drug coverage for it. And so those are important notes. Comparing Part D plans, like I mentioned, we're looking for the lowest premium, and there are plans that have a $0 premium, and is our pharmacy in network. We do this on the Part D side with you. What are our medications going to cost, right? So in this example, this is a $0 plan. This person goes to CVS Pharmacy and takes Lipitor, and they fill this 10 milligram Lipitor once a quarter, so every 90 days, and it's $5. It's a $5 copay per fill. So we don't even need to worry about this deductible because we're not going to hit it. Whereas you can see here, CVS Pharmacy is out of network. It's got a $12 a month premium, and our drug cost would be $20 per fill. And so it's important to note, are your drugs covered, and is your pharmacy in network? Do I need to enroll in drug coverage? Yes, a resounding yes. So no medications? Great. Pick the least expensive plan, or risk a late enrollment penalty if you don't enroll into drug coverage. That's important. There are creditable sources of drug coverage that are Medicare eligible, that you wouldn't have to go pick up a prescription drug plan. So we talked about TRICARE. Someone made a comment about TRICARE. That's an credible source of drug coverage. VA coverage in many cases is a credible source of drug coverage so long as you're filling your meds at the VA. Or your spouse's employer plan, right? So if your spouse continues to work, maybe they're younger and they're going to work up to 65, et cetera, their employer plan in many cases can be creditable drug coverage. The employer plan, if it's not considered creditable drug coverage, is required to identify that and note it to covered individuals. Ensure that if you go the Medicare Advantage plan route, that you have embedded drug coverage if you're on an Advantage plan. Important timelines to consider. Believe it or not, we spend almost every day at Move Health this time of year talking about October and November. Why? Because there's important timelines to be thinking about. There's the open enrollment period coming up, but today we're talking about turning 65. And so what that means is we need to think about Medicare enrollment periods for someone who's in their initial enrollment period. So this is a 7-month window. This is 3 months before your 65th birthday, the month of your birthday, and the 3 months after. Does anybody in the chat know when, if you're turning 65, when Medicare starts? So let's say I want to start Medicare. I'm turning 65. I'll use this example. I'm turning 65 on August the 19th, tomorrow. Does anybody know when Medicare would start for me? I don't know. We'll see if it's in the chat here. The first day of your birthday month. And great work. Yes, ding, ding, ding. You get 283 points as well. You can pool those together with Tim if you want to buy something really great at the end here. But it starts on the first of your birthday month. And so what that means is if I'm born on August the 19th and I turn 61 or 65 this year, Medicare is going to start on August the 1st for me. The only caveat to that is if you are someone who's born on the 1st, it begins the 1st of the month prior. So if I was born on September the 1st, Medicare would start on August the 1st for me if I was turning 65. So you have this thing called an initial enrollment period, and it's a 7-month window that is 3 months before your 65th birthday, your birthday month, and 3 months after. What you can do within this window, you can enroll in Original Medicare Parts A and B. You can enroll into Part D drug coverage. You got to get A and B before you can dance with a supplement or an Advantage plan or drug coverage. And so you got to get A and B, but you can enroll in Medicare without any penalties. If you miss this window and you don't have another source of creditable coverage, you might have a late enrollment penalty. And there might be, rules on when your Medicare can start and things along those lines. And so that's what you can do. So enroll in Original Medicare, 7-month window, 3 months before your 65th birthday, your birthday month, and 3 months after. This is why we like to start the Medicare conversation with someone, a client of a financial advisor, about 6 months before age 65, because we're not in this window, we're not feeling the crunch. And usually, if you're at the 6-month window before your 65th birthday, you're starting to get advertisements like crazy. And like I said, those aren't from Medicare or a Medicare supplement. Those are from Medicare Advantage plans. And why do we say that it's important to sometimes kind of ignore those advertisements that come in? Well, because insurance carriers are paying a lot to get you to look at those. That's one step. The other piece is enrollment into a traditional Medicare supplement like a Plan G, and I'm going to use an insurance term here, so brace yourselves, is typically only guaranteed issue. So guaranteed issue, meaning they can't ask you any health questions for a period of 6 months from your Part B start date. So if I turn 65 on August the 19th, my Medicare Part B start date, if I applied for it, would be August the 1st. And so I would have 6 months from August the 1st to enroll into a Medicare Supplement Plan G or its equivalent, or any Medicare supplement for that matter, with no underwriting. And that's important because not all of us make it to 65 without some bumps and bruises and pre-existing conditions. Maybe our height and weight's a little out of whack. Maybe we take some medication, things along those lines. There's only a finite period of time where you can get a Medicare supplement, guaranteed issue. So if you want a Plan G, it's important to get it right as soon as you start Medicare, whether you're working past 65 or you're turning 65. Whenever your Part B start date is, you've got 6 months from that point to pick up a Medicare supplement to go into place. Happy to answer any questions that come up around that. But that's why we talk so heavily about that fork in the road. Because guess what? You can always go to a Medicare Advantage plan. You can't always go back to a Medicare supplement. So at 65, our strong preference is that you would start into a Medicare Supplement Plan G or something of that equivalent because you don't have the medical underwriting. If you started in an Advantage plan and then said later on, I want to go to Original Medicare and a Medicare supplement, that sounds a lot better, and I don't have a network, and I want to go see that doctor, the Mayo Clinic in Jacksonville, Florida. I want to do that. Well, if I'm outside that 6-month window, they can start asking me health questions. What's your height and weight? What medications do you take? And at that point, they could either rate you up and say, we don't like that medication you take. You're going to pay more for your Medicare supplement. Or they could just flat out say, we're not going to take you because they're not federally required to outside of the 6 months from your Part B start date. There are some state regulations that change that a little bit. New York, Massachusetts have some rules around that. But for most cases, 6 months from your Part B start date. I stress that because it's really important. You can always go to a Medicare Advantage plan. There's no underwriting for that. No health questions asked. You can't always go to a Medigap plan there. Here we go. If you have creditable, here's a question that came up. Thanks, Roger. If you have a creditable insurance when your window starts, can you delay your guaranteed issue window until later? Roger, that's a great question. Yes, you can, because you can actually apply at 65 for Medicare Part A only, right? If you wanted to. We'll talk a little bit about this in the working past 65 side of things. But yes, you can delay your guaranteed issue period because it's from when you start Part B. And if you remember, Part B is the portion that you pay for. So great question there. There's also the Medicare enrollment period. So this is October 15th through December 7th. This is the time of year when you want to review your Medicare, regardless of what coverage you have, whether it's Medicare Advantage or Original Medicare and a supplement or a drug plan. You always want to review your drug plan during this time of year if you're on original Medicare. And what we say typically is marry your Medicare supplement and date your prescription drug plan. So every year we're going to say, hey, we like our drug plan. It's doing what we need it to do. We're going to review it because those can change. Your Medicare supplement that works along with original Medicare is federally required to do the same thing every single year, right? So marry your Medicare supplement, date your drug plan. And this is the time of year to review your drug coverage. It's also the time of year, if you're on a Medicare Advantage plan, to review your Medicare Advantage coverage. You could theoretically switch from original Medicare to a Medicare Advantage plan. You could switch from Medicare Advantage to original Medicare, but just doing that during that time of year does not create a guaranteed issue window because it's just based upon your Part B effective date. So important, this time of year, October 15 through December 7, review your Medicare, regardless of what it is. If it's a drug plan and a supplement, review it. If it's a Medicare Advantage plan, review it. Drug plans and Advantage plans change every year. There's also a Medicare Advantage open enrollment period. That's the first quarter of every year. It's only specific to folks that are on Medicare Advantage plans. So you have to be on an Advantage plan to utilize that because you can't switch from original Medicare to an Advantage plan during that window or change your drug coverage. It's someone who said, hey, I don't like the Advantage plan that I enrolled into during November or October or December. I want to switch it. You can do that there. So that's the Advantage plan open enrollment period. We're going to do some bonus learnings here. Working past 65. So I know there was Ann that was out there. There was a question from Roger. Here you go. If you continue working beyond 65 at a job with at least 20 employees, it has to be what's considered a large employer that provides health insurance and creditable drug coverage. You can hold off in enrolling in Medicare, but you would defer Part B. So you could pick up Medicare Part A. That's the premium-free portion. It'll coordinate with your health insurance at work if you'd like it to. Many people take it because it's premium-free, but you would need to defer Part B. And that guaranteed issue window, Roger, to your point, is based around your Part B effective date. So it's not uncommon for someone who works past 65 to have a Medicare Part A effective date of, let's say it's my example of August 19th, of August the 1st, 2026. But maybe they're working 3 more years and they're going to retire at 68. And so their Medicare Part B might be August 1st, 2029, right, as a start date. And so that's when that window would open. So great questions there, but hopefully that clarifies. And you don't have to have it so long as you work at an employer with more than 20 full-time benefits eligible employees that provides health insurance to you. Next up, if you're receiving Social Security benefits for 3 or more months prior to your 65th birthday, you're automatically going to be enrolled in Medicare Parts A and B. So if you're taking Social Security and you have been for a while prior to 65, you're going to get Medicare Parts A and B. If you're still working and don't want Medicare Part B, they're going to send you a card proactively. They're just going to say, hey, here's your Medicare Parts A and B. Congrats, you got it. You've been drawing Social Security. You're part of the system, et cetera, et cetera. There is a way to defer Part B actively in that case, which is they send you the card, there's a process to sign the back of it and send it back, and then you can apply for Medicare Part B when you have a qualifying life event like loss of employer coverage. If you are working past 65, be sure that you stop HSA contributions 6 months before you intend to transition to Medicare. So why do we say that? Well, because Medicare Part A can backdate up to 6 months, from the date that you apply for it. So if you're working past 65 and you're saying, hey, I'm going to retire at the end of 2027, stop your HSA contributions after June of 2027, because this is only if you're working past 65. If you're working up to 65, you can contribute to your HSA up until you turn 65. A thing to note here that is not written, and if you have any part of Medicare, you can't contribute to an HSA. So if you have any part of Medicare, you can't contribute to an HSA. That includes Medicare Part A. Though it's premium free, you can't contribute to an HSA in that case. There's a question in the chat here. Natalie says, when should clients start to work with your team if they want to review their drug coverage for open enrollment? Natalie, I believe you're an advisor. I think that's the case, one of our Freestone friends. So good to see you. Thanks for joining. Good question. We're going to send out some correspondence to everybody that talks about this. But that's typically, we're not going to have any drug coverage details until at least early October, but we can't enroll or review anything until October the 15th. That's when that series starts. And so we'll make certain that you have notes on when to begin engaging those. But I love that our planners are on here and they're asking those questions. That's great. One last note on working past 65. Please heed this note. COBRA coverage is not considered creditable coverage according to Medicare. I'm going to say something that might make you scratch your head a little bit, or maybe it was just me. COBRA is a continuation of your employer coverage that you had. If you are otherwise eligible for Medicare, regardless if you have Part A and B or not, COBRA is only required to cover the 20% that Medicare does not. Because COBRA would say, hey, we're not going to cover everything that Medicare covers. We don't need to do that. If you're otherwise Medicare eligible and not working, you should be on Medicare. And so COBRA works like a reverse Medicare supplement in the worst way. If you had COBRA and you're over age 65 and you don't have any part of Medicare, they are going to say, hey, you had that $100,000 knee surgery? Great. You should have had Medicare. We'll cover the 20 grand. You're going to be responsible for the 80. So that's important. If you're otherwise Medicare eligible, do not take COBRA. James McKay asked a question. What tax year is used by Medicare to determine IRMA if spouses turn 65 in different tax years? James, such a good question. So IRMA, the income-related monthly adjustment amount, or what I call the you did well for yourself tax. Good question there. What tax year is used? Well, it's used whatever, if you're married filing jointly, it's whatever it is 2 years prior. So if I turn 65 this year, it's going to look at 2024. And then my spouse, turns 65 in next year, it's going to look at 2025. So it's always looking 2 years back. And IRMA is unique to the individual, just like Medicare is for everybody. Medicare Parts A and B and your Medicare supplement, your drug coverage is yours. It's individual. And so IRMA is assessed on an individual level as well. So even if your tax filing status is married filing jointly, it's going to review it based upon your 65th birthday. And so hopefully helpful, and I explained that well there, James. But really, really good question. If your spouse turns 65 in a different tax year, it's just going to be 2 years back from whenever that is. And it's going to be assessed every single year. So let's say that, 2 years ago you had a low income year, but in 2025 you had a big income year. You sold a lake house, whatever it might be. You might be 66 and you might have IRMA that applies from your income from 2 years ago. So all of that to be said, it's a really great question around that. I'll kind of zip through these last pieces here because I want to get to what to check when you're enrolling in Medicare. Provider networks, if you're going Medicare Advantage, check the drug formulary. That's a big insurance term there. That's the big list of covered medications for your Part D drug coverage. What are your medications going to cost? Rate increases if you're exploring your Medicare supplement, like I talked about, historic rate increases, carrier stability within that as well. Verify what your IRMA may be. You can't appeal IRMA until it's been assessed, and so you might have to pay it one or 2 months before IRMA, before you can appeal it. And then the big one is just understand what your out-of-pocket exposure is. A lot of times a Medicare Advantage plan looks really attractive on a month-to-month basis because it costs nothing. And you say, well, I don't want to spend $150 or $200 on a Medicare supplement. Well, that doesn't necessarily matter because when you go to use that Medicare Advantage plan, it might end up being more expensive. And anything insurance related, you don't want to find out that you have bad car insurance until you wreck your car, right? Same thing goes for health insurance or Medicare. You want to make certain you understand how it works and what your out-of-pocket exposure is in the worst case scenario so that you can prepare for that. So great questions. What's your next step? You might be asking that. Natalie might be asking, what's my next step for my clients, right? Contact your advisor to initiate what's called a health planning analysis with Move Health. We're going to review all the things that we talked about. When you need to apply for Medicare Part B. We're going to review the drugs that you take. We're going to review the doctors that you see, carrier stability, what your medications are going to cost. We also do the same work in the pre-65 space. And so keep that in mind. If you're someone, we've seen it a lot more than I'd like to see, where maybe a spouse is turning 65 and is Medicare eligible and says, I'd love to retire, but my younger spouse is 63 and I guess I'll work 2 more years until they make it to Medicare. That doesn't need to be the case. There's options in the pre-65 space as well. And any good planner would tell you, just be prepared to plan for it. And so happy to answer any other questions that might come up during this time. I'm so glad that we got the time. That's actually on the nose, 1 hour. So thanks for sitting with me and hearing me out. It was great to talk about Medicare with you all. Hopefully you left this feeling better, more confident, and with a clearer understanding of how Medicare works. Again, I'm Cole Craven, co-founder, head of growth here at Move Health. If you have other questions, feel free to send those to us, info@movehealth.io, or again, reach out to your financial advisor. Our team of non-commissioned, salaried, licensed team members would love to talk with you and help you to walk through any questions that you have. And so, Jennifer, Daniel, thanks for the encouragement there. Love y'all. Have a great day, and we'll talk soon.